Hello and good morning, all. I've got another coronavirus update. But before I get into this, please subscribe and like my videos if you think I'm doing a good job. Share them if you think your friends will like them, and comment down below about what you think of this story. This was published 50 minutes ago along Fox News. Doctors and nurses fighting coronavirus are having pay and benefits cuts as employers lose revenue, which is bullshit. Employers should just look at this as a godsend. They can gain tons of goodwill by paying mainly the nurses more, because nurses, I know a bunch of nurses, and they get shit on. Now on to the story. Emergency room doctors and nurses who are putting their personal health at risk to treat coronavirus patients are now seeing their pay, compensation, and other benefits being cut as the economic impact from the pandemic is spreading through the medical industry, which is bullshit. Staffing companies that have contracts with hospitals and employs those who work in emergency rooms say the coronavirus has eaten into one of their main sources of revenue, non essential elective procedures, which are being postponed nationwide as states are directing facilities to go all hands on deck to fight the pandemic. Despite the risk our providers are facing and the great work being done by our teams, the economic challenges brought forth by COVID 19 have not spared our industry. Alton Health CEO Steve Holtzclaw wrote in a memo to its employees earlier this week, which was obtained by ProPublica website. The company, which says it employs more than 1,700 clinic clinicians across 16 states and the NDC wonderfully announced a temporary reduction in hours for them, a 20% pay cut for administrative staff, and suspension of 401k matches and paid time off. Oh man, you're gonna have all those people leave and go to a company that's not screwing them over. Hotel said in his memo that he isn't sure for how long these changes will remain in effect. As soon as it goes in effect, those companies never goes back. They're like the government. As soon as they can get anything out of you, nothing's ever temporary. But based on recent Holzer said in a memo he isn't sure how long the changes will remain in effect, but based on his recent conversations with other health care employers, you can be assured that similar measures are being contemplated within these organizations will likely be implemented in the coming weeks. Good way to have a bunch of people leave if you're going to screw them over for putting their lives at risk. A medical director who says he is classified as Alton's Health Administration employee told the website that the cuts to him amount to a loss of around 20 grand a year. Each day I'm in the county and federal emergency meetings. This is besides seeing patients. I do more hands-on work right now than I ever before, he said, speaking on the condition of anonymity. I'm getting calls 24/7 from hospital administrations, the county management team. I have not had a day off in over 2 weeks, and I'm working all this for 20% less. The director added that he understands Alton's Health new economic outlet, but he wishes the company let the employees choose their sacrifices instead. Decision is being made not by physicians, but by people who are not on the front lines, who don't have to worry about whether I'm infecting my family or myself. If a company cannot support physicians during the toughest times, to me there's a question of integrity. The company has no integrity. Plain and simple. I'm going to say that the company is scum. Alton Health, which is supported by private equity firm Fraser Health Partners has not responded to requests for comments from Fox News, but it's not the only company trimming compensation for hospital staff during the coronavirus outbreak. In Massachusetts, Arcturus Health, a network of more than 1,100 physicians, primary care providers, and others, announced that some staff will have 10 to 15% of their pay withheld through the beginning of May under expectation they receive it later. Oh, bullshit. I would quit if I had a fourth of my pay gets yanked out. Newspapers, that's from the Boston Globe. The newspaper, citing an internal memo from a tourist health CEO, also reported that non physicians who are now finding themselves in less demand because of the crisis are now being asked to take a 1 month unpaid furlough with health benefits. Why won't the CEOs take a month without pay? Like every healthcare organization here and across the country, we are operating in uncharted waters. No, you plan for the absolute worst. They did not do that. In the light of the realities we face as a result of the drop of routine patient visits and cancellation of elective surgeries, our practice must adapt quickly and decisively to protect our patients and preserve our mission. No, you guys are idiots because you did not think that this could happen, so you never planned for it. The newspaper also reported emergency room staff in Beth Israel Deaconess Medical Center in Boston have been informed that some of their acute pay is being withheld. This is at a time when many of us have moved out to live like lepers, separate from our family to prevent spreading the infection. We have already been working huge hours trying to scrape together personal protective equipment and other space for COVID. Matt Bivens, an emergency room doctor, told the Globe. And Tenet Healthcare, a company that runs 65 hospitals and is headquartered in Dallas, announced postponement of 401k matches. Ah, shit. Yeah, they're just screwing over nurses, which is bullshit. Uh, but I can go on forever just being pissed off these people. Someone should take them to court and sue the asses off them. If you made it this far, let me know what you think about the companies doing this to the healthcare workers. Bye bye.